live stream, please?
Right, good afternoon, everyone, and welcome. If we go straight into the first item, which is really just appointing people to various committees. I'll read through the committees because I think most of the people are exactly the same as were there last year, with the exception of one. So it's to the Good Neighbours Network, Cadley and District Citizens Advice Bureau, Frimley Health NHS Foundation Trust, Hampshire and Isle of Wight Healthcare, that used to be known as Southern Health, Hampshire Autism Board, Hampshire Hospital NHS Foundation Trust, and I think we've got 1, 2, 3, 4 lots of appointees there. Portsmouth Health and Overview Scrutiny Panel, Safer New Forest Strategy and Delivery Group, University Hospital Southampton, and Surrey and Borders Partnership NHS Foundation Trust. And as I say, all the appointees are people who are already in post and have been doing it and have carried on, with the exception of the Hampshire Autism Board. And I'd like to give my thanks to Councillor Menahan for having done it for some time, and welcome back to Councillor Carpenter, who has done it in the past and is now coming back to the board. And I'm very happy, June, to approve all those appointments.
Thank you.
Okay, and I think that's me finished. So with great delight, I'll hand over to Councillor Oppenheimer.
Thanks very much, Liz. And I just mentioned that this continues to be webcast, and get straight on with the first item for me, which is the Hampshire Primary Care Public Health Services contract. And could I ask you, Simon, to say a bit about this item, please?
Many thanks, Councillor Oppenheimer. So this is the paper to approve spend of just over £28 million for public health primary care services, which are part of our statutory duties to deliver. It's in 2 parts. So one is long-acting reversible contraception, and the other is the NHS Health Checks programme, both delivered by primary care due to the clinical nature of the service and the way the service has to be organised. We are going to go out to tender for a maximum of 7 years, with the initial 5 years with a +2 going forward. And the paper also asked delegate authority to myself for awarding the contract once we've been out to procurement, recognising this is a service to be provided by primary care. So that's GP practices in this case. Many thanks, Councillor Oppenheimer. Happy to take any questions.
Thanks, Simon. Well, let's just see if anyone else wishes to ask anything or say anything before I say something. Liz, Bill, would you like to come in at all on this one?
No, I think it's quite straightforward, actually, this one.
Yeah.
Agreed.
Well, all I want to say is that I think these health checks are really great, and it's a really important thing to, to our whole sort of health and well-being agenda. If people go and have a health check and find out that, they've got some problem, high blood pressure, or, some risk to their heart, then they're very likely to take steps to improve their health. And, that early warning is vital, not just to preventing death, but vital to just getting people healthier so that they can enjoy their lives more. And so I'm very happy about it. Oh, Leslie, I didn't realise you're on the call. Hi, Leslie, do you want to come in?
Yes, please. I'm so sorry. I was just swanning around my house thinking the meeting was at 2:45. So sorry, I do apologise for my tardiness. 2 things. Did I read that there are only 95 people qualified for the long acting? And are we happy that that is sufficient? And the other one was in relation to the health checkups. I have some concerns that the ones in the community are perhaps not placed in the best place to access for deprivation. So in Gosport, we had one at a community hub, which you could only reach if you had a form of transport. So if you're somebody who has no money, that is a barrier that's going to stop you getting a health checkup. And we know that they are hard to reach, and there are sort of target demographics. So that's my questions. But yeah, very supportive of the health checkups. It's just removing the barriers as far as possible to get them. Thank you.
Thanks. Good question. Simon, do you want to handle that one?
Yeah, thanks, Councillor Meanahan. So on the long-acting reversible contraception, you're absolutely right. We need to increase the number of people able to deliver. So we have got a large training programme. It does take a commitment from primary care staff to undertake that, but we are increasing those numbers by training and facilitating that so that more people can access that in primary care. And that's been an ongoing programme with primary care under pressure. Releasing people to get training is always a challenge, but we are really moving forward that very well now. With regards to the health checks, this is a slightly different part of the programme than you mentioned. So health checks are delivered in GP practices, so that's obviously throughout the community. The bit you've mentioned, we are really trying hard following COVID to identify different ways of delivering it, and you've mentioned that it's not always as accessible, so we are working with a company to make it more accessible. If there are more places where the mobile service can be located, please let us know and we will work with any community. Obviously there's got to be enough people there, but we'll do anything to increase our uptake. So I'm very happy to chat to you, Councillor Meanahan, about Gosport and what would work.
Sorry, and if I may, Russ, following on from that, I know it's an aside, I can't help but think when people do the health checkups, you almost need other people there that relate to those health issues to help them improve at that moment. So you might get a health checkup and it might be about blood pressure. So if there's someone else in the room, or if there was a leisure centre that does the gym membership to sort of grasp it at that moment, I think we really missed an opportunity when it comes to that. That's all I have to say. Thank you.
I think you're right. What we've seen traditionally is the health check is taken up by a certain number of people, but then that behaviour change doesn't happen. So we are changing the way that we are kind of having a relationship with primary care, saying actually we need to pay for more of the outcomes and get more people to give up smoking and moving to leisure services. You're absolutely right, and that's the way we're going.
Yeah, Leslie, I'll just say that something that Simon and I have talked about a lot over the last year is cross-selling our public health services through the GPs, also through our social workers. And I agree with you. You know, if someone goes in for a health check, then I hope they will be made aware that, well, firstly, the county council's funded that health check, but also the county council funds smoking cessation services through Smoke Free Hampshire. We fund the Slimming World and the exercise opportunities that we have. So, you know, we are helping people to get healthy, but people have to be aware of it. But there is still work to do on that sort of cross promotion, and we are working on that. So I think we'll turn to the recommendations, which are on page 11, recommendations at para 2 and 3, and I am happy to approve the spend for the Public Health Primary Care Services contract, and I am also happy to delegate authority to the Director of Public Health to make those awards. And yet, let's really do our best to raise awareness of this free health check opportunity and the long-acting contraception opportunity. Thanks very much. Next agenda item, My Happy Mind. Simon, again, over to you and to Charlotte to say a bit about this one, please.
Many thanks. I'm sure Charlotte here will help you with any questions. So this is a decision to spend £101,000 for a programme about emotional health and wellbeing in our North East Hampshire schools. So with our partnerships with the ICB, the rest of Hampshire has been covered by this very effective programme that has really made a huge difference to the health and wellbeing of our young people, really empowering education settings to work on emotional health and wellbeing in a really different way. It's been really successful. We want to make sure that that can be for all schools. So this grant is to work with the schools in North East Hampshire to assure the committee the rest of the schools have had this offer, but because of the way that the ICBs are in two parts for Hampshire, we've had to do a separate part in this way for North East Hampshire. So yeah, we're really keen to deliver this, and we know that our Be Well survey shows that mental wellbeing is really, really important, as we all know, and this is a really effective programme for delivering improvements, and teachers say it really empowers them to have effective conversations.
Thanks. Charlotte, did you want to add anything?
not particularly from what Simon said. I've had a personal experience of my little one's been learning it in school, and it's been amazing actually, the things she's coming up with. So yeah, I think it's wonderful that it could be extended, hopefully.
Good. Well, that's good to hear. Well, thanks, guys. I am happy with my happy mind, and I'd just like to see if my other council colleagues would like to say something. Bill, I think you were just putting your hand up.
Yes, I fully endorse it. I would like to know what schools you're visiting in the Northeast and when, just so that we as councillors can keep our, thumbs on the pulse to find out how it's going. And we can also obviously tell the other councillors in the Northeast area when it's happening. I think that's important that they know when it's happening.
Yeah, Councillor Withers, it's an offer for all schools, and we can let you know, but really it's more of it's not about people going in, it's about empowering the teachers. So it now will be available for all of them to access as soon as they want to.
Right.
Leslie, anything you wish to add?
Yes, thanks, Russell. Can I just ask Simon, how long has this programme been operated in the rest of the county? And if you're empowering the teachers, is there any follow-up to which teachers choose to use it or not?
I can't quite remember how long it's been in Hampshire. I don't know if Charlotte knows. I think probably about 9 months because it came out of an ICB funding. That's a really good point. I don't know if we've actually got the details of which teachers have followed it up. We'll know which schools have taken it up and we can follow that up. So very happy to share that details with you afterwards, Councillor Fairhurst, about the school uptake. But you're absolutely right. You may find a teacher is particularly keen, but actually was quite good at this anyway. So how do we really think about those teachers that are less comfortable talking about mental health well-being and therefore can empower everybody to do that? But I know, as Charlotte said, it's a really effective programme. Charlotte, do you help me out there?
Yeah, so I think it's been in most schools where it's taking part, it's timetabled, it's taking part alongside the PSHE, so they might have a time each week where they're all doing it. So the teacher's been trained, and there's a parent portal for parents to be aware of what's going on with their children. They can access the portal as well to carry on the learning at home with their children. So it tends to be a timetabled lesson that they're all taking part in.
That sounds good. Yeah.
Well, that is good to have that discussion. And I know it says in the paper that there is going to be monitoring and evaluation for this Northeast bit. So I guess that's happening in the rest of Hampshire as well. And look, just generally, I'm glad that we're doing something in the whole of the county. It would be wrong to have a service that wasn't operating in the whole of Hampshire. One day our borders and our contracts will be aligned, and then it will be easier. But in the meantime, we've got to do this sort of thing. Anyone else wish to come in on my happy mind? Okay, well, let's turn to the recommendations then, which seem to be paragraphs 2 and 3. And I would like to say I'm happy to approve the total spend and to delegate authority to Simon as Director of Public Health. And yeah, you're never too young, I think, to start thinking and talking about mental health. And I think that the benefits of this programme will be many for the children. So I'm happy about it. That's the end of my agenda items. Thanks very much, everyone. I'll hand back to you, Liz, to close the meeting.
Okay, well, thank you very much for attending, everyone. And we look forward to the next one in a month or so. Thank you.
Thanks, everyone.
Thanks. June, do you want to stop the recording?